So one of the questions that has come up repeatedly is what to do if you get symptoms. So if you develop a fever, body aches, upper respiratory tract symptoms, or cough and shortness of breath, you should be evaluated by a healthcare professional. If you're not sick enough that you feel that you need to go for healthcare, you can stay at home. The main thing is, it's really important not to be going out and about if you're feeling sick. If you're not feeling well, you should be staying at home and you should be isolating yourself from other people. So the recommendation is for people who test positive, and even for people who don't get tested, who have symptoms that are consistent with COVID-19, the recommendation is to stay away from other people for 10 days. So for people who are not sick enough to be hospitalized, after 10 days, you are no longer contagious. So if you get tested and test positive, or if you have symptoms and don't get tested, either way, you should stay away from other people for 10 days. If you're sick enough to be hospitalized, we know that some of those people will actually shed virus for a little bit longer, so the Centers for Disease Control recommends 20 days for people who are sick enough to be hospitalized. For people who are not that sick, 10 days is sufficient. So the things to do if you are quarantining at home, make sure that you're getting plenty of rest, make sure that you're eating well, and that you're taking care of yourself. Stay away from other people. So that means don't go out to grocery stores, don't do the things that you would normally do if you were not sick. So you really need to stay in and stay away from other people. If you live with someone, you should be in a separate room from them, and you should really be trying to limit contact as much as possible.